Hi, Dr. Michael Norman, Key West Spine and Injury. I'm here today with a very special guest, my mom. And so we're going to share my mom's story, which is really my story, our story. And so her story was a car crash years ago, decades ago now, and it was what I would consider a typical car crash, meaning there was no broken bones, no blood, no ambulance trips to the emergency room. She just thought she'd been in a fender bender. So what can you recall years ago? What happened in your accident?
Well, I was at the end of a freeway ramp and just got hit from behind.
And did you immediately have any symptoms?
Well, immediately getting out of the car, yes. I was extremely dizzy, because very shaken up.
So initially, no severe pain, just kind of shooken up, but shortly thereafter, something started to get worse. What happened?
Well, my head, and then my neck and shoulders, and my head was the worst. And I thought, I need to go to the doctor. And the symptoms continue, and I'm feeling worse. So I do go to the doctor. And so I get medications, pain medicine. I think it was probably those muscle relaxants. And I always get ill from those. Pain medicine doesn't work with me. So it wasn't working.
All right, so you continue to get worse. Things aren't getting better.
Yeah.
So what finally brought you to do something different, to try something different? What specifically happened?
Well, actually, it was a recommendation because I wasn't feeling better and I wasn't doing well with the medications. So there was a member of our church who recommended chiropractic. I had never been to a chiropractor. I wasn't even sure what that was all about, but I was ready to try anything. And so that's how I got to my first chiropractor.
So you were a little skeptical, not too bad, but more desperate.
I was ready to try.
Desperate to try
Yeah.
anything. Okay, that's very typical.
Yeah.
And so what kind of results do you recall? How quick?
Yeah, I guess I was most impressed because the chiropractor knew what was going on with me, and he could explain it to me, and he could start to treat me. There was a treatment plan, and it did involve medication and the side effects to the medication, and I began to feel better, and I was very confident in my recovery.
Great, and so you had results right away.
Yeah.
Great. So you're feeling better,
Yeah.
You're confident, you're on the right track finally, and so you're thinking chiropractic's so great that you even know someone that you think should be a chiropractor one day.
Yeah, you.
Yes, she likes to say she knew I was going to be a chiropractor before I did. So the funny part of the story, the plans didn't go off so well when she called me to say she was doing better, she was at the chiropractor. Of course, my response, Mom, over the phone said, Mom, don't go to chiropractors, those guys are quacks. Yes, and that's what I literally told her years ago, decades ago now, when I found out that not only she was going to chiropractor, but she thought that was a great idea that I should be a chiropractor.
Yeah, that's right. So the next time you were home from college, remember, I said, come along with me, and I took you to the chiropractor with me that day so you would meet him.
And guess what? It made sense.
Yeah.
He explained, he showed me her x-rays, explained what the technique, what he was doing, and again, in the word, it made sense. So it made so much sense that I looked into chiropractic and started exploring colleges and started talking to chiropractic students and other chiropractic doctors, and it just kind of grew from there. So literally within a couple of years, I was off to chiropractic college. And just like all those years ago, it made sense to me. My hope is that today, this is starting to make sense to you. And you see not only why I'm a chiropractor, but why we focus on whiplash recovery and those that have been injured in a car crash. So if you're out there, you or your loved ones have been in a car crash, please don't suffer like my mom did all that time years ago. Get in right away. Let's get you started. Let's get you some relief. So again, please like, share, comment, subscribe to our channel, and we'll see you again next time. Bye-bye.